Hello everyone, this is a USMLE orientation seminar brought to you by the MedPrep Medical Coaching Lahore, Pakistan. This is our contact number 0344-430-6890. Please visit us at our website medprep.webs.com. This is our teaching institute, the MedPrep Medical Coaching or the Academy. Again, our contact number 0344-430-6890. We do the home tuition as well as the academy. We do the crash courses for MBBS all professional examinations. We do the University of Health Sciences oriented preparation. We also coach for USMLE, and we believe we are the best in the USMLE coaching. We teach step 1, step 2 CK, step 2 CS, step 3. We also prepare you for the match and the residency interview. We also deal in PLAB, AMC, FCPS Part 1, MRCP Part 1, PMDC. We do the comprehensive coaching of these examinations. We have a highly qualified tutors. Me myself, I am a 999 holder in USMLE and a PGY1 resident of a University Hospital of USA. Dr. Ali Raza Kamar is also with us, who is a 99 holder and a PGY1 resident of a well-renowned hospital in Baltimore, Maryland. Again, the contact number 0344-430-6890. So let's start with USMLE. USMLE is United States Medical Licensing Exam. You need to clear the USMLE for any medical career in USA. Now, if you have decided to go to the US, then you have to pass the USMLE. Now, what are the pros and cons of going to the USA and doing the USMLE? The positive things or the pros are that USA provides the best clinical training, no doubt about that. And after you are done with your residency, you get a very good income. If you are working in USA as a hospitalist, you get a very good pay. And if you plan to do fellowship, you get a very healthy income after doing your fellowship. Even if you are working in USA, or even if you are working outside the USA, say in Middle East, the US trained fellows get much higher pay than the British trained or the Pakistani trained fellows. Now, the negative things about the USMLE or the USA are preparing for USMLE is a very lengthy process. It takes at least 2 to 3 years to prepare for USMLE, and it's costly. It costs at least $5,000 and even more. And initially, in the start, while you are doing residency, in the start of your residency, you do not get a very good income. An average PGY1 resident gets $2,500 per month, and also it is very tough to get into competitive specialties like orthopedics, dermatology, anesthesia, radiology, etc. So if you are planning to do orthopedics, dermatology, anesthesia or radiology, then probably USMLE is not for you. Now, what should be the aim of taking the USMLE exams? Why are you taking these USMLE exams, and what should be your aim? The aim of taking and passing these USMLE exams is to get a residency in a hospital program in USA. Now, there are community hospitals where you can do the residency. They serve the community, they only treat the patients, but they do not have any fellowship opportunities. Then other university programs, they have the fellowships. The university programs have fellowships. Then there are hospitals which are in between the community hospitals and the university hospitals. These are known as the university affiliated community hospitals. These are community hospitals, but they allow the residents to do electives in a university hospital. So it increases the chances of getting the fellowship. Now, what is a residency? It's a 3-year training program in a hospital. It's comparable to the house officer system here in Pakistan. But in Pakistan, you work as 1 year as an intern, but in USA you have to work 3 years as a resident. Now the residency is done in different specialties like the internal medicine, surgery, family medicine, peds, etc. But remember, the subspecialties like the subspecialty of internal medicine like the cardiology, gastroenterology, rheumatology, these are the fellowships. After doing the residency in internal medicine, then you can do the subspecialties like the gastroenterology, cardiology, rheumatology. Now how to get to a residency program, or how you can improve or increase your chances of getting a residency. The most important criteria set by the programs to screen the international medical graduates or the foreign medical graduates are the USMLE scores. Now, as the competition in USA is getting very tough, to get a residency in USA is now getting very tough. So aim for a score of 95 and above in USMLE Step 1 and Step 2 CK. The second most important criteria to screen the internal medical graduates used by the residency programs are the US clinical experience. The residency program directors prefer the candidates who have got a good US clinical experience. We will talk about the US clinical experience or the USC later on. Now, the last but not the least is that you should have very good communication skills and English proficiency, because when you are going for an interview for a residency program, you need to have good communication skills and English proficiency, and also these things also help you a lot in USMLE Step 2 CS. Now, what are the exams or the USMLE exams? There are 3 to